feel free to ask any questions and share thoughts in the chat box as we kind of go. It is lovely to see your faces, so I have some sort of sense of whether or not I'm speaking to the void, but I appreciate if operationally, if you can't have your camera on, or technically, as is sometimes the case with Teams. I will hand over to Becky then.
Hello all, just making sure that I've got my mic up. I've already got it off. Fantastic. Hi everybody, my name is Becky Brown. I'm the Market Development Manager at Norfolk County Council in the Commissioning and Care Markets team. I'm here with a couple of different colleagues here today, so we'll do some introductions first, if that's okay. You might know some of us already, but it's nice just to say hello at the top end. So can I see on my screen? Matthew, would you like to go first?
Yeah, hi everybody. I know some of you, but some of you I don't. I'm Matthew Mallet. I'm a commissioning manager in the working age adults team at Norfolk County Council. So we do cover all of working age adults. My particular area is learning disabilities, but I do touch on a little bit mental health and PD and other things, but I am responsible for supported living, shared lives and that kind of supported accommodation.
Thank you. And we should also have Stephen.
Hi, I'm Stephen Felt. I'm one of the accountants at Norfolk County Council supporting adult social care. The main aspect of my remit is the commissioning side, helping Becky and the commissioners work out the appropriate prices to pay.
Big job.
Yeah.
Thank you both. Okay, so we're here today just to talk to you in the early stages about the annual fee review process that we do in adult social care every year. We're going to start by Stephen just taking us through a few slides, and they're going to summarise some of the sort of the wider financial and operating context that's relevant to this year's fee uplift process. As John mentioned, we're more than happy just to take questions as we go, but we will pause after those first few slides. So if you have got any specific questions that relate to that, you can ask them. And very happy for you to either write them in the chat or to just come in and talk to us. That would be fab. And then we're going to continue with Matthew and I. We're going to be sharing a few slides that relate to this year's sector pulse survey that we released last month. We've been doing some analysis on the findings from that survey, and we're going to share them with you today. We're particularly keen to hear from you in terms of, does it feel like the analysis represents your own experiences of the current financial and operating environment that you're working in at the moment? If so, we'd really like to hear some of your own personal experiences that relate to those things. And if they don't, we'd also like to hear those. We utilise all of the feedback that we gather through these sessions as part of the annual fee review process, but we also use it in a much broader sense. So we can use it for lobbying government, for example. Last year we did exactly that with NorCA's support around the increases to employers' national insurance contributions. So all of your experience really matters, and these are the opportunities for us to be able to hear it. So the more conversation from our perspective, the better. Hope that sets the scene okay and what everybody was expecting. So I will share my slides if that's okay, Caitlin. Can you see the big green screen?
Yes.
Yep, great. Okay, so I'll hand over to Stephen for the first part. Thanks, everyone.
Yeah, just put it on to the next slide, please, Becky. So just to give you a bit of context to what's going on with the environment we're all operating in at present. In terms of Norfolk County Council, over the last 8 years, adult social care has achieved over £100 million worth of savings. And in the demands for adult social care, we normally have to deliver around about 40% of the annual savings requirement for Norfolk County Council as a one of the largest spend in the local authority outside of the schools grant. In the current year of 25-26, we've injected an additional 59 million into the adult social care budget to deal with the pressures and growth aspects we're seeing within the social care field. but that's still given us pressures to manage within our spending powers at the moment. We are having to prioritise actions which are reducing and slowing our level of spend to meet our legal requirements to deliver a balanced position as a local authority. In the economic field, we are seeing that inflation has stabilised, but it still has some very high component parts to it, which is including the energy, insurance, food, property maintenance costs, to name a few. And these all do remain high compared to pre-pandemic levels. So that is something which is impacting providers, cost of living, multiple different markets across the field, and also big pressure to local authorities to deal with. Getting into a bit more about the market side of things, we know that at the moment in Norfolk, we definitely have and across the UK, we have an aging population. People are living longer. That's leading to more complex needs and multiple conditions coming through on that. And we need to make sure that people are accessing the services at the right time and the right fields. We've also got to bear in mind that choice and expectations need to be met within our Care Act's responsibilities, and making sure that we are putting the right level of care in the right places at the right times. We know workforce is also a big challenge. There's loads of national and local incentives to try and get people to move into the field, but providers have been reporting to us on a regular basis they sort of got high vacancies and high staff turnover, which is making things difficult and retaining skilled staff. We're also aware that there is some forthcoming employment legislation changes, which I'll get to on some of the funding streams which are coming through on that. Care quality, so quality in Norfolk is improving, but we do continue to benchmark poorly against our comparator areas, and we do need to work with yourselves to improve that where we can. There's also significant financial and viability pressures across the piece, but particularly in the working age, adult, residential and supported living services. So, and this can be specific to geographical areas in home care as well. So we are understanding those kind of different pressures coming along there. Next slide, please, Becky. Just to go over some of the budget considerations which we need to go through at the moment. So one of the big things at the moment compared to last year is that the autumn statement is later in the financial year. By this time last year, we already had the autumn statement and understood what direction the government was going in and some of the other aspects which were coming through. The autumn statement is due on the 26th of November, so that will tie in a number of aspects once that is announced, and the accompanying policy information which comes with that. The government committed last year to doing a fair funding review and a 3-year settlement, so we are anticipating a 3 years worth of funding agreements to come through this year, but we don't know how that's going to look at this moment in time. Under current estimates and planning of information, Norfolk County Council has a 62.5 million funding gap for 26-27. Adult social care's share of that is circa £28 million at this moment in time. Discussions are still going on with members with how those savings targets can be achieved, and plans are being drawn up about how we can come up to that sort of level of savings within the service. The national living wage has not been announced. That usually comes out at the similar time for low pay commissioning as the autumn statement. So we're anticipating that in the next couple of weeks. But in estimates at the moment is the wage is looking to raise £12.71, which is 4.1% increase from last year's uplift. There is a range though that it could be as low as £12.55 or as high as £12.86. These are estimates, and until we have a better indication, we can only work with what is being provided. And at present, the £12.71 is the estimate which is being projected. CPI currently at 3.18%. The OBR estimation was 2% for 26-27. The OBR's estimate was backed in March, I believe, of earlier this year. So a lot has happened since then. Those numbers will be refined and released as part of the autumn statement package, of which then we'll take a step about what sort of levels. But we know there's a big difference between that 2 and 3.8%, which has been blocked as a concern. There is also the Fair Pay Agreement, which is out for consultation. That won't be implemented till 2028. There is £500 million being set aside by central government to help fund that position. But at this moment in time, we don't have the details about how that will be provided and split out between the local authorities. Next slide, please. So, known drivers of cost. We know that between 60 and 70% of costs is associated with labour. So a big chunk of the pricing we are paying is for the staffing costs in packages. The graph is kind of showing what's happened over the last 10 years with the national living wage. So we can kind of see that it has steadily been going up over the course of the year, with some big spikes during the cost of living crisis, where we did see nearly 10% uplifts back in like 23 and 24. However, last year that did come down quite a bit, and we're expecting another decrease this year as well in comparators to those very high years. But we know that is really pushing the cost prices up in the fees we're currently paying out on the fee uplift process. Next slide, please. We also know that inflation is a big factor, and we can kind of see how inflation has changed. Again, this is going back to 1997, where it did kind of stay below 2% before then starting to creep up in the mid-2000s, but nothing as unprecedented which happened in the last few years with the inflationary increases, which were driven mainly from the war between Russia and Ukraine, which really drove up a lot of those additional costs, especially around utility costs and the costs of energy provisions, and the cost of food, which has gone up significantly. We are, as I mentioned earlier, the estimates from the OBR was it's come down to 2%. We're at 3.8 as of I think it was September's data. We're just waiting for October's one to be published, which should be sometime this week normally. But again, it is still very, very high. And in terms of the financial planning, so the budget pressures for 26-27 are extremely challenging, but have been every single year. There's tough decisions to be made, which do go through chief officers and members to agree with a lot of challenge before they're actually put forwards. There's uncertainty with the available funding, and the lateness of the statement that makes this even harder to kind of challenge what our exact position is going to be and how much funds we're going to have. It's very important from these sessions to kind of gather the intelligence from the market, so it can kind of help make informed decisions and give all the appropriate information to the chief officers when they're making their decisions about what they want to do in terms of the fee uplift process in this instance. Officers of the council and elected members, they need to always take into account the Care Act, especially around Section 5 of promoting diversity and quality of provision for the service. Once we've kind of gone through all of that, the paper will go in January 2026, stating what the position of the fee uplift process will be and the valuation which will be put across that, with how that's been calculated and how it got down to that sort of value, and the decisions which have gone within that. And it's equally important for providers to have sufficient notice to understand the implications. We try to do this as timely as we can, but with those kind of deadlines we have from central government and understanding our funding envelope, it can feel a little bit rushed in that kind of sense, but we are trying to do it as quickly as we get the information.
Hi all. So I don't think I saw any questions come in as Stephen was speaking, but we can pause there just for a minute. So I'm very happy to take a couple of questions about that bit in particular, if anybody has any.
And I think just to add a couple of things that are helpful to the discussion on the last one. So to put in kind of context, and Stephen, correct me if I'm wrong, the £59 million injection is circa 20% of the budget, and the savings target of 20 something million is circa 9%.
Roughly that, yeah.
Yeah. So again, just to give those large numbers some sort of percentage sense and how they might relate. And Becky inserted this into the last conversation, but when Stephen mentioned the 60 to 70% staffing costs for providers, that there was an acknowledgement that there may be some dispute as to what figures are best or most accurately reflect providers. And I think one of the key things out of this engagement exercise we want to, is support a case for what is right for the market and different parts of providers, what is fair.
Wonderful. Okay, thank you very much for that, Stephen. Okay, so it's over to Matthew and I now. We're going to take you through some of the findings from the Sector Pulse survey that we did this year. I haven't done this in the previous one, but I am interested. Interested to know whether how many of our people that are in the room today actually have heard of the Sector Pulse survey before, and whether or not that you have been involved in completing it, just to get a sense of people in the room. So whether or not you just want to put a little note in the chat, whether or not you have completed it, yes or no, that would be great just for us to be able to see. But while you are doing that, we'll kick off and just start taking you through some of the findings. So let me click through. This is the second year that we've actually run the Sector Pulse survey. It's based upon something that Care England do at a national level. They've been doing it for a number of years, and then they're able to look at the data year on year to see how things are changing for providers across the country. When we looked at that information from a Norfolk perspective, we thought it was really helpful, but what we thought would have been even more helpful is to have been able to understand what all of that information was like relating to our own providers in Norfolk, whether or not that was there were similar findings for our providers in Norfolk, or whether or not that actually some of the challenges and pressures that you are facing are different to the national picture. So we decided to do a local version of this Sector Pulse survey so we could do exactly that and try and see how we compare to the national picture. What we've also been able to do this year, because it's the second year, is just compare locally how things are changing. So I think that adds a layer of interesting findings to this survey. Sorry, I've got frog in my throat. There we go. Let's see if that clears it. So it's 24 questions that we ask. They're a mix of multiple choice questions and free text. We generally speaking had a fair amount of additional commentary that people were happy and willing to talk to us about. And we tried to summarise some of those themes throughout our findings, and we'll share them with you. This year we had 338 providers engage with the survey. What engaged means in this context is opened up the briefing that came along with the survey questions and perhaps started the survey but didn't necessarily complete it. That represents 15% more engagement at that level than last year, and we had 136 providers that fully completed the survey. That's a 5% increase overall, but this year, just in related to supported living and housing with care providers, we had 22 responses, which was a 100% increase on last year, because I think we only had 11 last year. So that was good news for us that this particular part of the market engaged with the survey a little bit more fully this year. So I can see a couple of people have popped into the survey that they have, into the chat, that they did complete the survey. So thank you very much. If you haven't completed it or haven't heard of it, this is just a good nudge to hopefully make you aware that this is something that we've done for the last couple of years and most likely will continue to do next year. So do keep your eyes open for the opportunity to engage. It tends to be around October, so that we can come to these sort of November subgroups or this time in the year to be able to understand some of what the survey is telling us. So section 1 just is sort of the opening part of the survey to try and understand which providers have engaged with this with the survey, and it just gives you a few statistics to give you an indication from a supported living perspective which providers completed. So we had around 27% of the people that completed the survey were finance directors, 23% senior managers, and 14% owners or proprietors. That's a good mix. I say a good mix. It is a good mix of people to complete the survey, but what we primarily ask is that the people that do the survey just have a really good understanding of the business. So that will be from a workforce and a finance perspective, because it's really important the detail around the finance is as accurate as possible. Most organisations who completed the survey from a supporting living perspective employed between 50 and 249 people, so that was around 50%, and that was closely followed by slightly smaller organisations employing between 10 and 49 people. And then across to the side on this slide, you can see how that translates to then the number of people that were supported by those individual providers over the previous 12 months. So the majority, you can see, a kind of supporting between, say, less than 10 and up to 100 people over the last 12 months, but a small number of providers who are the larger providers supporting, you can see, into the hundreds of people. So year on year, when we get to this point in our fee review process, one of the inputs that we consider from a local authority perspective is how costs are changing. How much of providers' total costs are designated towards supporting staff costs, and what proportion are for all of the non-staff costs. That's really important because that helps us with our financial modelling to understand how that is changing and how our fees need to respond to those changes. We use things like evidence from previous cost of care exercises, things like the surveys that we have been doing now for a couple of years to try and understand that cost. For supported living last year, you told us that around 75% of your costs were staff related and 25% were non-staff. And you can see that this year that shifted to 80% of staffing costs and 20% non-staff costs. So obviously representing a pressure in staffing, and that's a bit of a trend that we have certainly picked up on the last couple of years, and not overly surprising with some of the additional changes that came in last year around employers' national insurance contributions as one example. I think this might be the last one for me. This one gives a good sort of overall indication of how costs are changing. So these specific questions relate to the previous 12 months. So we asked providers, thinking about your staff-related expenses, how have they changed over the last 12 months? 50% of providers reported that those costs have increased significantly, so that's over 5% in the last 12 months. But that is, so the bit in brackets is comparing to last year, so 23% less providers told us that this year. 32% of providers reported that costs had increased slightly, so that's between 1% and 5%, and that was an increase on last year. For non-staff related expenses, 23% of providers reported again that non-staff expenses increased significantly in the last 12 months, but 32% less than last year. And 64% reported that costs had increased slightly, which is 90% more. So my takeaway from that is that costs are continuing to increase, but more likely in that 1% to 4% sort of region compared to less than last year, who were saying that they were 5% and above. We asked what were the top 3 cost pressures that providers are currently facing. So similar to last year, workforce related costs was number 1, right at the top of the list, so 95% saying that that was in their top 3. That was followed by delayed fee payments from local authority, which is a new one in the top 3 for this year, and regulation and compliance costs, which we are seeing as a bit of a trend throughout all of our analysis for the other sectors so far. So those two, so the fee payments and regulation, actually replace last year's technology and rents and mortgage payments or costs, sorry, within the top 3. So a bit of a shift in terms of trend this year for supported living providers. We asked how providers are dealing with some of these additional cost pressures, and then we tried to group them into, again, sort of top 3. Most providers telling us that internal efficiency savings is number 1. It's sort of the business as usual, trying to find more efficient ways of doing things, that came out as 91% of providers saying that that's what they're doing. Secondly, it was growing or trying to increase income. And third was utilising reserves. I have added a 4th one here because within the analysis, it was quite clear to me that there are a number of ways that providers are telling us that they were dealing with cost pressures that were very close to, say, utilising reserves, which are around 45%. And they were things like closing down services, staff redundancies, and also curbing investment. Those 3 also came through really strongly as themes that I thought were important to highlight as part of this. Then we talked about surplus and deficit. So how are organisations currently doing in terms of their financial health? And in the most recent 12-month period, 45% of providers said that they are operating in a surplus position, but that's 19% less than last year. 23% reported a deficit position, which is a 4% increase. And 32% were either unable to answer that question or declined to answer that question, which was quite a significant increase on last year. And then the final point of this one, we asked about where operators are operating in a surplus position. How is that changing over time? And 23% of providers suggested that that financial position has decreased significantly, over 5% in the last 12 months.
Thanks, Becky. So I guess Becky's gone through some of the kind of numbers, and this is really now going into some of the more qualitative kind of reasons behind some of what providers have been saying to us. So the first question was around organisation staff related expenses and how they've changed over the last 12 months. Excluding national living wage, but of course that's always going to be a key kind of issue. So first of all, won't be any surprise, we've talked about that, that national insurance and wage costs have been the biggest increase and the biggest issue over the last 12 months. That combination of wage rises, national insurance changes, significant impact on staff related expenses. Recruitment and retention, that was, last year was certainly, we talked about this last year as well, in terms of the added cost of you as providers having to increase your recruitment and retention enhancements to attract quality staff, and we have had a number of tenders out this year, and I know one of the questions we ask is about recruitment and retention, and we have seen across the board significant approaches and increases to recruitment and retention kind of bonuses and benefits in order to attract kind of candidates, and appreciate that is a significant cost pressure on the market and agency, which it hasn't gone away and is and remains a significant cost pressure in terms of staffing related expenses. And then lastly, training and development expenses. I think this was in that top 3 last year as well. Training providers putting up their prices, they are passing on costs that they are incurring to you as a market, so that's impacting kind of your costs, but also the recognition that we continue to have kind of complex young people coming through from children's services, complex needs, increase the training requirements that are needed to sort of support those young people, so that can increase kind of training costs as well. So lots of lots of issues there. Next slide, I think, please, Becky. So we talked about staff related expenses, and then we've kind of asked the question around non-staff related expenses. So I'll start with the middle one here, which is kind of regulatory costs. And I was having a conversation with a provider only a couple of weeks ago who mentioned how expensive CQC kind of fees were, and I sort of looked into it, hadn't done for a while, and was kind of surprised at just how much CQC fees are, and appreciate that has come through from these questions, as well as kind of other kind of insurance based compliance fees, which are just adding to costs for you as providers. Everyday operating costs going up as well, in line with just everyday costs increasing. So, again, insurance, property costs going up, being told about technology costs going up. I know a lot of providers over the last year or two have been moving over to digital care planning, which clearly incurs a cost, and those that haven't are kind of going that way. So that is clearly a significant added cost as well, on top of staffing costs. And then in the first box there, utility and property costs, which perhaps relates more to kind of perhaps housing with care, other kind of markets that wouldn't necessarily be supported living, where those kind of property, utility, council tax costs are kind of covered by housing benefit and service charges. But nevertheless, it's clear that utilities, council tax, maintenance of properties, cleaning materials, food, all of those, hotel costs, daily living costs are all going up. And where there is a responsibility on you as a care provider for those costs, that is going to be having a significant impact on those non-staff related expenses. So next, thanks, Becky. So yeah, this is changed a bit from last year. So this is around a question we asked about, has your organisation actually considered exiting the market in the last 12 months? Now, last year that was 0, so no providers responding had said that they were considered exiting the market. I think this is now gone up to 18%, which is obviously a marked difference. I think the context here is that this could be that a whole organisation may be reporting as looking at exiting, or it may be that a particular service or services within your group or provider are you're perhaps looking to decommission or exit particular services. So that is a change. We have had in Norfolk over the last 6 weeks actually, for the first time in my 8 years here, a provider exit nationally the supported living market because of significant financial pressures. So there is clearly additional pressures there now that have built up over time, and that is causing providers to now think, actually, are some of our services viable? Norfolk, we know it's a rural county. There are particular issues and viability issues around rural services with travel and transport costs, staffing costs, where you perhaps have had stable staff bases for many years, but with staff looking to retire, bringing in new staff at some of those rural locations really difficult to do, causing sort of viability issues. So appreciate there are real issues there, and just aligning with something earlier that Becky said, a lot of certainly the learning disability supported living market that I can talk for, there's a lot of non-profit and charities in that sector that have very small surpluses each year, so it doesn't take very much, we appreciate, for actually that viability to become an issue, because there is a small margin on a lot of providers operating in this market. So next, please, Becky. Okay, so then this is about how can we kind of work together differently, or to kind of mitigate or minimise some of the challenges. So the 4 kind of key issues that came out of this are, making sure that uplifts reflect real costs. I don't think any of you will be surprised that would be number 1. I have conversations and have got conversations ongoing at the moment with providers who are saying, the uplift that you've awarded last year doesn't bridge the gap that we have with the other costs that we now have. So not a surprise that the providers are reporting that gap is continuing to rise. Number two, paying promptly and resolving delays. I mean, I'm really sorry to see this as a local government commissioner. I would want to see that you as providers are getting paid promptly for the services that you're delivering. I think that hopefully should go without saying. I think, seeing that there are 5 months to get a contract in place isn't really good enough. I think I will be reporting that back. We are reporting that back to the most senior level. Work is going on to put different processes in place to mitigate against some of that, and we need to get that right so that you as providers get paid for the work that you are delivering and the services you are delivering. Strengthening genuine collaboration. Again, I know that I think that came up last year again in terms of how can we just collaborate more meaningfully. I would say that, and you may want to challenge me on this, but I am told and continue to be told that Norfolk are pretty good on this. I think we are ahead of other local authorities, perhaps not all, but certainly a lot that I'm told of in terms of our collaboration. So this process, providers do say is really helpful, but of course we can always continue to do more. But I think that genuine collaboration is something that we want. But again, we take that on board, what the market is saying to us in terms of actually co-developing models, consulting even earlier if we can do. So that is recognised. And then planning for long-term sustainability. So looking at this, I wondered whether some of this was around, so we had a pilot. Well, we had a pot of money last year from central government called the Market Sustainability and Improvement Fund that was used in different ways in different sectors. Some of that was for short-term pilots, particularly in supported living around rural areas and rural sustainability. I wonder if some of this is a feedback from that, which is saying, okay, that's all very well to have a short-term pilot, but actually we need long-term sustainability planning, which is absolutely recognised. And yeah, funding models that keep services viable long-term, not just something that is going to go from year to year. So yeah, that again is recognised. Whilst short-term grant funding is helpful, it doesn't provide long-term sustainable solutions. So next slide, I think, please, Becky. I think this is the last one. I think we've talked and probably covered quite a lot of this already in various other sections. But the key workforce related costs, national insurance, living wage, agency, will be no surprise, I'm sure, to all of you. Measures due to staff shortages, agency use just still continuing to be necessary, but you increase providers increasing pay, offering flexible working, and then recruitment challenges. Pay rates continue to be an issue. The challenging nature of social care and the work in social care compared to comparative other sectors, and actually poor perceptions of social care as a career. Now last year that there was travel and access was one of the biggest issues, but the poor perception of social care as in terms of the impact that has on recruitment has been discussed now as having more of an impact than actually perhaps the travel and access rurality aspect that we have in Norfolk. And then average hourly pay, so reported hourly pay from the survey, £12.62 per hour, and 2/3 of providers said yes, they do align wage increases to the percentage increase in national living wage.
Thank you, Matthew. Okay, so that was the whistle-stop tour of the findings that specifically relate to supported living, and wanted to pause here, take an opportunity really just to talk to those of you that have come along today. Do these results feel reflective of the environments that you're currently operating within? Do you have any examples that you'd like to share with us that feel like they're particular pressures for your business at the moment? Are you anticipating that things will feel different next year? Any commentary that you'd like to share with us?